Right now we continue on the discussion when it comes to our youngsters, and earlier we spoke about the increasing number of children being diagnosed with learning difficulties within the school system. So this morning we are back with occupational therapist Nasreen Cariem to continue this talk and just help us parents out a little bit in terms of what to look out for and how to nurse those problems should they arise. Nasreen, lovely to have you back with us.
Thank you.
Like I said earlier, you know what, for us parents, when it comes to our children, it is a big deal. Nothing is too small of a problem. Now,
Absolutely.
let's talk about those learning difficulties. What are some of the most prevalent types of difficulties out there that children may deal with?
Okay, there are numerous learning disabilities, but the most common ones that we find are firstly the normal mild developmental delays, where children present with minor problems such as muscle tone difficulties and gross motor and fine motor coordination problems. Those are minor problems, but it can affect a child's performance in the classroom environment. And then you have more serious ones like ADD, which is when a child presents with a significantly short concentration span. And then you have ADHD, where in addition to the short attention span, you also find that there's hyperactivity present.
Yeah.
So you'll find them all over the place. And I assure you they're not being naughty. They are just, they can't help themselves.
They can't help themselves. And as parents need to remember that, because they are just children. You know, they act a certain way according to what they know, of course. But it's up to the parents to manage that situation. So when a parent figures out that there is some sort of a learning difficulty or a problem that their child might be dealing with, what are some of the mistakes that parents actually do go about making?
Well, generally, every parent wants to hear when they go to that parent meeting that everything is going well for the child. So not receiving that kind of feedback can be a bit daunting for a parent, especially if you're told that your child presents with a learning difficulty. A common mistake would be that sometimes parents tend to think that maybe the child might outgrow it eventually, which isn't always impossible necessarily, but if it isn't sorted out immediately, it can become a problem for them in terms of their functioning. So the important thing is that parents shouldn't actually be in denial about that, because often they find that they take it as a reflection upon them as parents or as a personal attack perhaps maybe, but it's not the case. It's just merely the teacher trying to point out that the child is a problem.
Can I also ask on the opposite end of the scale? I know that your child might suffer from some sort of a learning difficulty, but could a home environment or scenario or setup contribute to maybe having a learning difficulty? Maybe what's going on in the home environment?
Well, mostly it is genetic.
Okay.
So there has to be, you will find that if you're working with a child that has a learning disability, that somewhere along the line, whether maternally or paternally, there would have been somebody in the family that actually suffered the same as well. And often when parents come to me, I will find that when they are done with the assessment and the feedback is given, then the mom or the dad will say, wow, that was actually me when I was at school, you know? Yeah. So it's often that there is the genetic aspect has a huge element to it. Also, as you mentioned about the environment, it's important for a child to be in a stimulating environment. Okay. So lacking stimulation would also be a bit of a downer, but there has to be a genetic element to it mostly. Yeah.
So just to wrap it up, I mean, number one tip for you when it comes to parents dealing with learning difficulties, I mean, what advice could you quickly give?
Advice would be to just keep a hand on it immediately. Look at your child's strengths and weaknesses. Of course, it's difficult to get that negative feedback, but with all of that negative feedback, take it with the positive, because by doing that, you'll be able to enable your child to progress positively and to also make sure that you seek the necessary intervention, be it occupational therapy or speech or educational psychology, and that by doing that, you'll enable them to actually have greater options, more options in terms of choosing their career.
Once again, you know, as parents, we need to be aware of so much. Thank you so much for joining us this morning and all the incredible advice to make sure that as parents know what to do when it comes to those learning difficulties for our children. But we continue now with your Wednesday morning. Here's Zoe.